This tablet is a combination of vitamins and iron that are essential for the body. It is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are important for maintaining good health and are necessary for the body's proper functioning. When taking a Thru Z18 Mg-500 Mcg-300 Mcg-250 Mcg tablet, it's important to follow the instructions provided by your doctor or on the product package. Typically, it's taken once a day on an empty stomach, about 1 hour before or 2 hours after meals, with a full glass of water. If you experience stomach upset, you can take it with food. Avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they may decrease its effectiveness. It's also important not to lie down for at least 10 minutes after taking the tablets or capsules. If you are taking the delayed-release form or extended-release capsules, swallow them whole and do not crush or chew them. Taking the medication regularly at the same time each day will help you get the most benefit from it. If you have any questions about the best way to take this medication, consult your doctor or pharmacist for details specific to your brand. You may experience constipation, diarrhea, or an upset stomach when taking this medication. These effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, it's important to contact your doctor or pharmacist right away. Iron in this medication may cause your stools to turn black, but this is not harmful. If your doctor has prescribed this medication, they have determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. A serious allergic reaction to this drug is rare, but if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not listed, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects. You may also report side effects to Health Canada at 1-866-234-2345. It's important to be aware that products containing iron can be harmful if taken in large amounts, especially for children under 6 years old. Always keep this medication out of reach of children to prevent accidental overdose. If overdose does happen, seek medical assistance immediately or contact a poison control center. It's important to consult with your doctor or pharmacist before taking this medication, especially if you have allergies or medical conditions such as iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin also contains folic acid, let your doctor or pharmacist know if you have a vitamin B12 deficiency before taking it. It's also important to inform your doctor about all the products you use before having surgery. If you are pregnant or breastfeeding, consult your doctor before using this medication. Drug interactions can change how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you use, such as prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Be sure to consult with your doctor before starting, stopping, or changing the dosage of any medicines. This product may decrease the absorption of other drugs, including bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's recommended to separate your doses of these medications as far as possible from your doses of this product. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin also contains folic acid, be sure to inform your doctor or pharmacist if you take certain anti-seizure drugs, such as hydantoins. It's important to note that this medication may interfere with certain lab tests, which could potentially cause false test results. Make sure lab personnel and all your doctors are aware that you use this drug. If someone has taken too much of a Thru Z18 Mg-500 Mcg-300 Mcg-250 Mcg tablet and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or the local poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has prescribed this medication, it's important to follow their instructions and not share it with others. It's also important to keep all medical and lab appointments related to this medication. Some brands of this medication may also contain ingredients such as docusate. If you have any questions about the ingredients in your brand, be sure to ask your doctor or pharmacist. It's important to remember that this product is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods, so be sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you forget to take this medication at the scheduled time, take it as soon as you remember. If it's almost time for your next dose, skip the missed one and take the next dose at the regular time. Do not take a double dose to make up for the missed one. Make sure to store this medication at room temperature, away from light and moisture, and definitely not in the bathroom. Keep it out of reach of children and pets. When it's expired or you no longer need it, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.